Okay, let's talk about a health signal that affects millions of people, but, it's often ignored because of embarrassment or just plain confusion. We're going to look at erectile dysfunction in a totally new light, not as some isolated problem, but as one of the most important messages your body can ever send about your future health.
Really, this entire explainer boils down to answering one single critical question. Why is a healthy erection a sign of a healthy body? And believe me, the answer is the key to protecting not just your sexual health, but your heart's, your brain, your entire well-being.
So first, let's just get on the same page. What exactly is erectile dysfunction? Well, at its core, the physical mechanics of it are actually surprisingly simple, and it all comes down to one thing: blood flow.
Clinically speaking, yeah, it's the inability to get or keep an erection firm enough for sex. But here's the key takeaway. The number one physical cause is just not enough blood getting where it needs to go. This isn't some mysterious condition. At the end of the day, it's a circulatory or a vascular problem.
So what kicks off all that blood flow in the first place? It's a tiny molecule called nitric oxide. Honestly, the best way to think about it is as the ignition for an erection. See, healthy blood vessels release it, and that's the signal that tells the arteries in the penis to relax and let blood rush in. If you don't have enough nitric oxide, there's just no ignition.
All right, now that we get the what, let's dive into the why. And the causes are rarely simple. They pretty much fall into two main buckets: physical issues with the body's plumbing and wiring, you could say, and really powerful psychological factors.
And when you break it down, it's pretty revealing. Vascular issues, so problems with blood vessels, are by far the biggest piece of the pie, and they're often tied to aging and cardiovascular disease. But you can see that other things like complications from surgery, other health conditions, and of course your state of mind, all play a really significant role.
So what kind of physical triggers are we talking about here? Well, the big ones are conditions that quietly damage your blood vessels over time. Think high blood pressure, diabetes, and high cholesterol. Plus, surgeries in the pelvic region, for things like prostate or colon cancer, can directly impact those delicate nerves and arteries that are involved in the whole process.
But let's not for a second overlook the psychological side of things. This quote from one of our sources just says it all, doesn't it? Stress, anxiety, depression, they all have a direct physical impact. Your brain is the control center for this whole operation, and when it's overwhelmed, it can absolutely shut down the physical signals needed for sexual function. Let's just compare two different scenarios to make it super clear. For a healthy 25-year-old who's under a ton of life stress, any performance issues are very, very likely psychological. But for a 60-year-old who's just had major pelvic surgery, the cause is almost certainly physical damage to the body's systems, you see? Age and your overall health context, they're everything. Okay, so that's the problem. But what about the solution? Let's get to what I think is the most empowering part of this whole story: your toolkit for preventing this and for building a healthier, more resilient vascular system for years to come. And here they are, 5 science-backed, totally actionable strategies. And you'll probably notice, these aren't just for erectile health, this is the bedrock of overall health, period. Improving your diet, moving your body, getting good sleep, managing your weight, and avoiding things like smoking and too much alcohol.
I mean, just take diet, for example. This data is pretty remarkable. Following a heart-healthy diet, like the Mediterranean diet, was linked to a dramatically lower risk of developing ED. And while it definitely helps at any age, look at that. The benefit is most powerful when you start younger. We're talking a 22% lower risk for men under 60.
And what about exercise? The goal is actually pretty simple and achievable: 150 minutes a week of moderate activity. Think of it like a brisk walk where you could still chat with someone, but you're definitely working. So why does this help? Well, because exercise is basically like training for your blood vessels. It makes them more flexible, and it boosts your body's production of that all-important nitric oxide.
Of course, for a lot of men, lifestyle changes on their own just aren't enough, especially if there's already an underlying physical cause or damage has been done. So let's turn to the highly effective medical treatments that are available today.
Doctors usually follow a really clear, tiered pathway, and they always start with the least invasive options first. So step 1 is typically oral medications. If those aren't the right fit, the next step involves more localized treatments like injections or gels. And finally, there are some incredibly effective surgical options.
Those well-known first-line pills work by improving blood flow throughout the entire body, not just in one specific spot. And the good news is they are successful for a clear majority of men, with somewhere between 50 and 70% finding them effective.
Now, for men who haven't had success with the other options, the surgical penile implant is often the final step. And get this, the patient satisfaction rate is an incredible 95%. It's a highly successful and reliable solution that has, no exaggeration, changed countless lives.
So let's pull all these different threads together, shall we? We've talked about blood flow, risk factors, prevention, and treatments. What is the single most important message you should take away from all of this?
Here it is. This is the crucial point. Erectile dysfunction is very often an early warning sign. You see, the small, delicate arteries in the penis are often the very first place to show signs of damage from the same disease process, like plaque buildup, that will later affect the much bigger arteries of your heart and your brain. It truly is the canary in the coal mine for your cardiovascular health.
And that brings us right back to where we started. So we'll leave you with this question to think about. If your erectile function is a real-time barometer for your vascular and heart health, what is it telling you right now? Paying attention to that answer could be one of the most important things you ever do for your long-term well-being.